Hi, Nathan Ritter from CardioGauge.com. I'm a cardiologist in New York. This video is about Entresto, a commonly used heart medication. I'm going to talk about how the medication works, how it's dosed, effectiveness, side effects, some drawbacks, and then at the end I'm going to discuss how I use Entresto in my daily practice. Let's get right into it. Entresto is a combination of two medications, Sacubitril and Valsartan. It came out in 2015 and it's made by Novartis, a humongous drug company. The medication treats heart failure with low pumping function, or ejection fraction, and let me show you what I mean here. This video clip shows a very weakly pumping heart. You can see the heart muscles barely moving. And then this clip here shows a normally squeezing heart. So for people with low pumping function, Entresto can be used with the purpose of decreasing the chance of death and decreasing the chance of hospitalization. It has three basic functions, which both of the two medications accomplish. It enlarges the arteries or dilates them, which leads to a decrease in blood pressure. This makes the heart work less, and turns out that in general it's a good thing for people with reduced pumping function. It decreases cardiac muscle cell enlargement or hypertrophy and decreases the scarring that can occur around heart muscle cells in the condition of weak heart pumping function. This leads to a decrease in heart muscle stiffness, which turns out to be a good thing. Importantly, it increases the urination of excess fluid and sodium, which has a number of effects. This can decrease swelling, decrease the symptom of out of breath, and also decrease the need for powerful diuretics, which can harm the kidneys, torsemide and furosemide. Dosing is done with 3 different tablet sizes. The first number that you see here, the 24, that's the amount of sacubitril in the pill, and then here 26 is the valsartan amount. It's a twice-a-day medication. The tablets can be cut, which gives a little more flexibility with dosing. The lowest dose is 12/13 twice a day, and the highest dose is generally 97/103 twice a day. It's typically started at a low dose and increased every 2 to 4 weeks, and it can be taken with or without food. The effectiveness of Entresto was proven in the very large Paradigm HF trial, which tested Entresto versus enalapril. Enalapril was previously proven to help patients with low pumping function. So the scientists and drug company wanted to see, was Entresto better than the old standby enalapril? The trial was funded by Novartis, no surprise. It ran for about 2 years on average in each patient. Death occurred in 17% of the people on Entresto, and it occurred in 19.8% of the people on enalapril. So there was a 2.8% lower chance of death if you were on the Entresto. Death from cardiovascular causes or a heart failure hospitalization happened in 21.8% of people on Entresto and 26.5% of people on enalapril. Let's look at those numbers a different way with the number needed to treat. That's the NNT. So if the person in the trial was on Entresto, they had a 1 in 36 chance of having death prevented as compared to being on enalapril. And over here, the number needed to treat is 21. So if a person was on Entresto, they had a 1 in 21 chance of preventing death from cardiovascular causes or heart failure hospitalization. That gives you some idea of your chance of benefiting if you're put on the Entresto as compared to enalapril. In terms of how doctors look at things, these number needed to treat values are pretty good. In fact, the trial was stopped early according to pre-specified rules because the benefit was perceived to be so overwhelming. I disagree with that concept because, after all, 17% of people who were taking Entresto died, so I'm not so sure about the idea that it was an overwhelming benefit. Anyway, I do use Entresto on a daily basis in my practice. I consider it a legitimate heart medication. It does seem to help people feel better and decrease the chance of hospitalization. So I talked about a lot of good stuff there. Let's go on to the bad, which surely exists with any medication. Side effects. Entresto can cause angioedema. That's swelling of the face, the lips, the tongue, the larynx. It happens in 0.5% of patients overall, but it's much more common in black patients, up to 2.5%. Worst case scenario is the larynx. Your voice box gets all swollen up and you can't breathe. So it's a legitimate side effect to worry about. My brother had it once. He was staying with me at my apartment, and I don't know, he's allergic to something there. Don't know what, but he woke up one morning and his lips were all swollen up and tongue was like, he couldn't talk right. He couldn't talk right. It's pretty scary. Anyway, if that type of thing happens, you need to seek medical care immediately, and then you're off the medication forever, obviously, if that were to happen. It can also cause low blood pressure in 18% of people, so it's quite frequent. We decrease the dose or just ride it out. It can cause high potassium, which is detected on a blood test quite frequently, 12%. Cough happens in 9% of people. If it's significant, we're stuck stopping the medication. Entresto can cause dizziness and then also worsen kidney function, which would lead to a decrease in the dose typically, or possibly a decrease in the patient's diuretic dose. Some other terrible things about Entresto are the cost. It's just amazing. It's $9 a pill if you pay retail, so that's $18 a day. Of course, Novartis has various programs to try and make the medication more affordable for people who don't have great insurance or maybe don't even have insurance, but overall I just find it to be an extremely expensive medicine that really impedes my ability to give it to people. Another crummy thing is the nearly universal drawback of the fact that its effectiveness was proved in a drug company sponsored study. The potential for bias is tremendous, and as we can see, they stopped the trial early because of this overwhelming benefit. When trials are stopped early, the long-term effect of the medication is less well known, which is the number 3 item here on this list. Really, what happens to somebody who takes Entresto for 10 years? Nobody could tell you for sure. It hasn't been tested that way. Okay, let's finish up with how I use Entresto in my daily practice. First of all, if someone is on an ACE inhibitor or an ARB, I'll stop that for 36 hours before starting Entresto. Examples of these types of medications are listed here. When I start Entresto, I'll use the dose matched to the prior dose of ACE or ARB. For example, if the person's on lisinopril 10 milligrams per day, I'll use 24/26 of Entresto. And if they're on 20 milligrams, I'll use the 49/51. Or if it's the 40 milligram dose of lisinopril, I would use 97/103. Then I'll check a blood test 1 to 2 weeks later to see what the potassium is, the sodium, and the creatinine, which shows kidney function. I'll assess the patient for an increase in dose at about 1 month. Basically, I want to see if the person's tolerating it. If they're not having any trouble with the medication, then I'll double the dose. And we'll do that process up to the maximum dosage of 97/103. Once we have the patient on a stable dose and it's not changing, I'll check blood tests every 3 months if the person has kidney trouble to start with, or every 6 months in someone with normal kidney function. And then if I have a really stable patient who's been doing well for a long time, I might just check the blood test once a year. Importantly, if someone ends up on the 24/26 dose or the 49/51 dose, I will have them cut tablets to decrease the cost, because they can get the larger pill for the same copay that they can get the smaller pill, and basically cut their copays in half by using a bigger tablet and cutting it in half. All in all, I think Entresto is a pretty useful heart failure medication. It's a little bit better than lisinopril or enalapril or Valsartan, as you can see from the study. It's not really a cure at all. 17% of people who took Entresto for 2 years in their trial died, so it's not like it's like the most amazing medication ever made, although it's priced that way. If my patients can afford it, I will generally put them on Entresto if they have heart failure with reduced ejection fraction. Thanks for watching. Please hit like and subscribe for more content, and leave your questions and comments below. See you next time.